We are better together during these tough times, but a disturbing new report from the CDC shows that for young people, these are very dark times.
And new survey results show that 1 in 4 18 to 24-year-olds seriously considered suicide to cope with stress related to COVID-19. But there is help.
Fox 12's Drew Marine spoke with Lines for Life about some ways you can cope during the pandemic. Drew?
1 in 4, it's a heartbreaking statistic, and Lines for Life says they've even seen an increase in calls to their hotline. In the CDC's report, they say younger adults, minorities, and essential workers are experiencing disproportionately worse mental health issues. The report also shows 25.5% of 18 to 24-year-olds who responded seriously considered suicide in the month before taking the survey. David Westbrook, the COO for Lines for Life, says this statistic is not surprising to him and offers other ways someone can cope during this unprecedented time. He says it starts with something as simple as putting your phone down before bed.
A couple of things we can do. We can stick to a sleep schedule across the 7 days. We can not pick up our phones for that last hour before we're going to bed. Connectedness is another thing that's super important and, of course, really difficult during this time, right? But figuring out how to connect with loved ones, friends, just folks who can really be there for that emotional support.
The CDC report also shows that people either began or increased their use of substances to cope with COVID-related stress. Westbrook suggests one way to avoid developing an unhealthy coping mechanism is to remove any substances from your home. Most of all, Westbrook says it's completely normal to feel stressed or depressed during a stressed time. If you need help, you can call the suicide hotline at 1-800-273-8255. We also have other resources available at kptv.com/bettertogether. Reporting live in Southeast Portland, Drew Marine, Fox 12 Oregon.